When you need a knee replacement, it's usually indicated for arthritis. Now there's different types of arthritis. There's osteoarthritis, rheumatoid arthritis, and can occur from traumatic injuries. What happens is you have cartilage in your knee, and the cartilage coats the femur bone, which is the thigh bone, and the shin bone, which is the tibia. Over time with arthritis, you get wearing down of this cartilage. The cartilage thins out and can eventually lead to bone spurs, deformity of the knee, and even bone-on-bone arthritis, which you'll hear that term used. That becomes very painful and can limit your ability for range of motion, limit your daily activities, and when it becomes to that point is when we start talking about a total knee replacement. So during a knee replacement, you can think of it as more of like a resurfacing of the knee. So we make an incision in the front of the knee, we expose the knee joint. When we expose the knee joint, we find where the arthritis is, and we use specialized guides to help us essentially cut the arthritis out. Once we cut all the arthritis out and we have new fresh bony surfaces, we implant metal implants that are very small pieces of metal that resurface the shin bone and the femur bone. Those are implanted with bone cement, which is a very strong cement that holds those implants in place. Then we place a highly engineered piece of plastic called polyethylene that acts as your new cartilage in between the two new implants. And it's a very, very smooth surface to allow for your new knee to have perfect range of motion and pain relief.